Hi, my name is Sophia, and I'm here with my dad, and we're interview, and I'm gonna ask him some questions, and he is an Upper Cervical Chiropractor. So, question one is, so how did you start this job? Like, why did you want to do it?
That is a great question. I'm glad you asked. So, my thoughts of chiropractic always was back pain, neck pain, and it didn't really excite me that much. I think it's good to help people who have that trouble, but it wasn't enough for me at the time. I learned so much more that it has to do with the nervous system and the spine and the connection of the spine to the nervous system and how the body works, that we can really help people to just function at an optimal level. No matter what condition they have, we can help them improve and do better. And it has a lot more to do with, helping people function and through their nervous system properly than it does with just helping them feel some better. So that was the main reason, is I wanted to help people, and I wanted to do it in a way that was maybe different than where everybody was going, different than the traditional route of medicine, drugs, surgeries. That can help some people at times, but this is a natural way of helping the body heal itself, and I think it's the best thing there is out there, the most custom form of healthcare in the world. I love it.
Amazing. So, what do you exactly do, like, to help people? What do you exactly do to fix an injury?
Very good question. Thank you. So, as an upper cervical chiropractor, my main concern and focus is looking at the nervous system, mainly through the brainstem. So I'm going to show you this model here. Is a model of the base of the skull and the top of the neck. And through this opening is where the brainstem descends down through. If these bones are all lined up properly, then brainstem sits comfortably and happily. If there's misalignment, and sometimes it could be, I've seen people less than a millimeter off. You would look at it and it would think it was lined up properly. But we measure it from different angles and we find that it's off. We get that thing in the right position and it makes a big difference. This helps nerve flow and blood flow get up to the brain properly, and it helps the brain messages get down to the body properly. We call brainstem area Houston control of the body, because all the messages must pass through there. And because that's the area that really runs everything. It sends impulses to the brain. Your brain cannot function correctly without transmission from brainstem, and then the impulses can't get to the body properly without going through brainstem. So we just work that area to make sure real precisely, real specifically, if that is not in the right position, then we're going to certainly help put it in the right position and help.
Awesome. So, do you help certain people?
Well, that's another good question. So really the basic answer to that is anybody who has interference here, misalignment in this upper cervical spine, would be a good candidate for this, regardless of what condition they have. Now, yes, I do tend to see people who have more head and neck injuries from like car accidents, falls, sports injuries, concussions. We see a lot of post-concussion syndrome, someone who's had a concussion and they're not getting better after weeks, months, years. A lot of times they end up here and we're able to find the problem, fix and correct it. People with movement disorders, people with seizures, pain syndromes. There's really a lot of things that we are able to help with. And just to be clear, this is not a cure necessarily for any of those conditions, as much as it is, if you have a problem and we check you out, and you can have any kind of condition, and we check you out and we find interference here, shouldn't you have that corrected and lined up properly to give your body the best chance? Mm-hmm. Whether it's going to make that all go away or not, let's just make sure the person is happy and healthy at the most important part of the whole body, and that's your lower brainstem.
Okay. So those were all amazing answers, and so those were all our questions for today. And if any of this information sounded interesting to you, then please comment, subscribe, share, and hopefully we'll see you soon. So
thanks. Bye. Nice job.